Good evening. Again, I'm Brenda Eaton. I am actually employed at the Chester County Intermediate Unit. The Intermediate Unit is an educational agency that supports the school districts in Chester County. We have a Brain Steps team at the IU, and Brain Steps is actually a statewide program. Started about 5 or 6 years ago, and it is actually a program that is funded by the Department of Health, the Department of Education, and then implemented by the Brain Injury Association of Pennsylvania. So it is a statewide initiative, so practically every county has a Brain Steps program. And with Malvern Prep being a private school, they have a variety of students coming from different areas, but we would support your child here at this school through Brain Steps. So my goal tonight is really to kind of talk about what Brain Steps does, but also kind of to bridge. You've heard Dr. Walsh talk about the medical piece. You've heard Mr. Mills talk about the concussion management team they have at the school. And I'm going to just take it a little step further and talk about the academic realm and how a concussion may impact performance for the student and what some of the strategies are. So you may hear some redundancy, you might hear some repeat, but that's because it's important and it's because it needs to be in medical, it needs to be in education, so just kind of consider it reinforcing information. I think you'll find it helpful that way. But Brain Steps is really a brain injury, a school reentry program. So it's really for any student that's had a concussion or a brain injury of any sort if they're in a car accident. We try to address all school-age students. So we have started doing early intervention, but we usually go up until 18 unless they have an IEP, which would be until they're 21. So without further ado, just to kind of talk about some of the academics, and I'll talk more about what Brain Steps can do towards the end of the presentation. A concussion, and again, just kind of repeating what you may have heard before, but you know, as a parent perspective, a concussion is really a mild traumatic brain injury. And a lot of people don't put that perspective on it when they're thinking about, oh, my son has a concussion, he'll be fine in a week or two. And I think a lot more is coming to the limelight on the news and in the sports about concussion, and we're learning more and more every day, and there's new research coming out every day. So it's really important to understand the significance of a concussion being a mild traumatic brain injury. So basically, some of the statistics that we have from the Brain Injury Association that we share, concussions in Pennsylvania annually are approximately 22,000 children and adolescents ages 0 to 21. The adolescent years being at a higher rate because of brain development and just, you know, more risky behavior and so forth. And just to also be aware, as far as another statistic, about 4,000 children and adolescents survive severe traumatic brain injuries that require hospitalization. So that kind of gives you an idea of the level of hospitalization. It's obviously a hard statistic to track. The hospitalization is easy enough to track, but when you're talking about random concussions, whether sports related in the home and so forth, it's really hard to track. So that's important to keep in mind. So all concussions are serious, and you know, it's funny to talk about what's a problem concussion and what's not. You could have a football player who gets, you know, really sacked on the field and you think is going to have a significant concussion, but they're fine in 3 weeks. The example I can give you, because working in Chester County, we serve so many schools, and I get involved with so many different students. The most unusual one would be a student who was sitting in his seat with his back against the wall, and one of his friends across the room chucked him a pretzel across the room. He put his head back to catch the pretzel. He hit it against the wall behind him, and it's 2 years later, and he still has a concussion. So, you know, you really can't know what's going to cause or impact that severity of symptoms in a concussion, but we are finding out more and more about rest and about best practices for trying to support recovery. About 80% of concussions resolve the first 3 weeks, and with Brain Steps, our policy is 4 weeks out after a concussion management team has been managing a student, you can send a referral to us. And our team members on our Brain Steps team are already consultants. They've been trained in various fields. We have OT, we have psychologists, we have speech, we have a volunteer from DuPont who's a physical therapist. So we have a lot of very knowledgeable individuals who have had additional expertise developed in concussion, traumatic brain injury, and so forth. Other things to be keeping in mind, that 80% that the schools are able to take care of those first 3 or 4 weeks. The lingering cases, you know, they can resolve in another week or 2, or they can be lingering and last up to 5 to 10 times, I'm sorry, 5 to 10 times, I'm sorry, I'll try one more time. 5 to 10% can last a lifetime. So the cases that linger, you really have no way of knowing how long they're going to linger, and it's different for every student. So it's really a challenging field to work in. Potential impact in class performance. Concussions or TBIs, mild traumatic brain injuries, are invisible injuries. So, you know, again, an example of a twisted ankle or a broken leg, you see crutches, you see bandages, but with a concussion, you don't have those physical signs to see that there is an injury. You know, for example, a student that's walking to the bus slips and hits his head, you know, there's not necessarily going to be any signs of anything happening. If they don't know how hard they hit their head and they don't know what's happening, it's really hard to know that there's an injury. The first educational professionals to notice changes are school nurses and teachers typically. So they're going to notice thinking, learning, and behavior changes. So some of the items that Dr. Walsh had listed were medical, some of them were educational, some to think of that are more educational, that if you're wondering, difficulty thinking and such things as having trouble remembering things, has trouble paying attention, reacts slowly, thinks slowly, takes things too literally or doesn't understand jokes, so their perception's a little off, understand words but not their meaning, thinks about the same thing over and over, has trouble learning new things, has trouble putting things in order, has trouble making decisions, has trouble planning, starting, doing, finishing a task, has trouble remembering to do things on time, or makes poor choices. So those are just some thinking skills that can be affected, and that's going to be affecting the academic performance and daily living. Trouble communicating, changing the subject made difficult. They may stray off topic, have trouble thinking of the right word, have trouble listening, has trouble paying attention and can't have long conversations, does not say things clearly, has trouble reading, or talks too much. So there's communication difficulties, so those are some other signs. Other things such as mood, irritability, some other things that were mentioned before, mood swings, wanting to be alone or away from people, afraid of others or blames others, feelings of depression. So, you know, some things that have been mentioned already. So academically, the thinking, the learning, the behavior happens, and again, can be affected. So again, if that student that slipped on the ice doesn't realize the level of injury, doesn't remember to tell mom and dad when they got home, hey, I fell, you know, earlier, mom and dad are seeing these symptoms, school professionals are seeing, you know, seems lazy, you know, seems, you know, like they're not getting enough engagement in class that they typically do, or going to the nurse and reporting headaches frequently. Those are all signs. So there's lots of ways of concussions happening and these things coming to the surface. So as far as treatment recommendations that I think Dr. Walsh had covered, but just to reinforce, again, treatment recommendations that would be recommended by a physician who understands the treatment of concussion would recommend some specifics. And I think it's important to understand, as Mr. Mills had pointed out, you really want to, you know, if you're going to seek out a medical professional, you really want to go to someone who knows what they're doing. Primary pediatrics, primary doctors tend to not have, not that they don't care, don't have the interest, but they don't have the awareness to know they need to follow up and learn about these things. They may not have the specifics because they don't do it enough. With the way the information changes and the research is changing, it's really beneficial to go to someone who really knows concussions. So typical things: remaining at home on total rest for the first several days after a concussion occurs. And again, this is something that's been said before. It's actually American Academy of Pediatrics in October of 2013 wrote a position statement in regards to that rest. And just to kind of highlight what they're saying is important, because while education doesn't have to follow the American of Pediatrics, the doctors do, and the schools do have to follow what the doctors recommend. So cognitive rest is recommended and may include a temporary leave of absence from school, shortening of the school day, reduction of the workload, and an allowance of more time to complete assignments or take tests. So I think it's really important to understand, and I think also is highlighted, not too sure what that rest time is supposed to be, but you know, from my point of view, and what I always tell parents when I'm doing the intake for our referrals, that rest time is not time on the computer. It's not time on the Game Boy. It's not time, for watching TV. It's meant to be complete rest. You should be laying down. You should be resting, not engaging in anything. So I know for parents that's hard, because you see your kids are getting bored. They're frustrated. They're not used to being so disengaged with things, but it's really, really important that rest take place. And even when they do start to get back to school, you really want to still stay away from the computer screen, you know, the phones, the texting, all of that, because that's kind of a drain. So again, the temporary leave of absence, it's going to probably depend on symptomology and how the child's feeling, and what the doctor recommends. Shortening the school day, so you know, maybe it's going to be half a day, maybe it's 3 days a week. It's going to kind of be dependent on what the concussion management team might see as necessary. The reduction in workload is really important. You don't want to be overdoing it with a student, and not just the day-to-day workload. Over time, there's work that you have to do that you're missing today, and then there's all the work that you missed in the past. You can't do both. So you know, it's really important to understand: are we going to work on what's going on today, or are we going to work on what's in the past? It's probably best to set up what's in the past into some kind of format and what needs to be made up. And I'll talk a little bit more about what that would look like, depending on how long they're out. Taking the standardized exams is definitely not something that's encouraged, because it's not going to be a reliable score. After reintegration into school, adequate time must be afforded to make up assignments. So, you know, if a student's missed half a year, you know, you really have to decide what's going to happen there. Are they going to be able to get everything in that they need to complete the year? They're going to have to repeat the year. I mean, those are tough decisions to make. The important thing is if they're able to get the key elements of what they're supposed to learn. So in other words, forget the worksheets, forget the busy work. If they're able to catch up on the essential pieces of what's supposed to be acquired by them by the class that they need to make work up in, that needs to be determined. And I think that concussion management team, something that BrainSteps could help with, you know, it really needs to be kind of a team decision about what's going to happen for the student, depending on how much time they've missed. So. And just as far as athletics, and just to reiterate again from the Academy of Pediatrics, until the athlete is totally symptom-free from a broad array of symptoms, they should really be restricted from any kind of physical activity. A concussion, also the Academy of Pediatrics mentions the fact that the depression can be a part of it, and that could be just from the long time away from sports, from friends, from typical routine of school. So that's not unusual. So the other piece is to reduce the opportunities for sustaining a second concussion before the first concussion is healed, and that is the second impact syndrome. You have the opportunity to really sustain some permanent damage. So it's really important to really make sure that first concussion is healed. The things that I've heard from the different trainings that I've experienced, it can take up to a year to fully recover from a concussion, even if you're back to school full time and you're going back to regular activity. So again, you know, research is out on a lot of the specifics, and we go with what we have. So Other types of impact, again, we talked about you may need to start off with a half day of school, no sports, no physical ed, no activity at recess. Social opportunities obviously are fine, but you don't want any opportunities for a second injury. Mental work should never be substituted for physical activity, so if they're not taking phys ed right at that time, that's not the time to be making up schoolwork. It really depends on the flow of things. So don't think that just because they have downtime that it needs to have that mental work put into it instead. Standardized tests, as I had mentioned before, should be avoided. Tests should be delayed if scheduled during the first week or two post-concussion. And once they are able to return to testing, they should really look at only doing maybe one test or quiz per day. And the testing can be different. I mean, you have to think with an open mind. You may need to provide a word bank. What you need to be thinking about what you're assessing whenever you're doing a test. Are you assessing for acquired knowledge? Well, you can do that through someone reading the test to you and you verbally giving the answers. You can do that by giving a word bank. You can do that by having a multiple choice test and reducing some of the choices. So there's definitely the ability to alter tests and quizzes and still get an assessment done. But it's really important to do it in a way that isn't going to antagonize any of the symptoms. Resting period is also very helpful or in a quiet area. Assessments should focus on essential key content, which I think I just kind of talked about. While student is in recovery, remove any non-essential classwork or homework. So, they may start back half a day at school, but they may not have any homework. And they aren't, taking tests, and they may just actually be coming just to be there for a half a day. It may not even be to acquire any knowledge. It may just be the fact that they're in the building, can deal with all the hustle and bustle of the hallways and the other students. And if that gives them a headache, then maybe it's, not time for them to come back. So, it's really important that you're evaluating where they are and for them to be self-aware too. And it sounds like there's a great scale here that's used to be monitoring what level they're at and what their functioning is and asking them how they're feeling. That's all just wonderful. So they're in tune with how they're feeling and functioning. Concussions that linger longer than 4 to 8 weeks, in that window, usually by then you have an idea of, are they on an uphill trajectory? They're making progress, it's just a little slower. Or have they plateaued? And if they've plateaued, then you need to kind of decide, do you need to do some type of evaluation to really kind of make a decision about, do you need to do more of a formal plan for the students so that they have the more intensive accommodations and modifications they need. So I think the most important thing, to take back as far as academics and so forth, we need to be considering what needs to be made up and how we're going to make it up and when we're going to make it up, what they're doing on a day-to-day basis and how they can do that. And again, being creative with how they can participate and how they can meet the requirements for what's going on currently if they're present, but not pushing the mark on their symptoms. You don't want to be pushing past their threshold of getting a headache or having a problem. And just as Mr. Mills said, you push those things, you're going to make the condition worse, and it's going to be a longer recovery period. So it's not doing anybody any favors to be pushing the student. On the other hand, with a student who is self-aware and is monitoring their symptomology, again, a scale of 1 to 5, and Monday reporting a headache at a 3 after sociology class, Tuesday they have a 2, Wednesday they have a 2, Thursday they have a 2, Friday they have a 1. So, something like that, you can see by monitoring that and the student reporting and being self-aware about how they feel, you're able to get an idea of whether they're going to be able to then move on to the next step. So data collection is really important. So doing that, and when they are starting to feel better and they are reporting less symptoms, that's when you do want to move up so that you are challenging them. You don't want to plateau and not be having any movement to help them move forward. So talking about current updates and new research all the time, Monday there was a study that was published out of Boston Children's Hospital 335 student athletes who were treated for concussions were monitored for the amount of rest. So the most cognitive rest symptoms, those that rested the most, were recovering by 40 days or after. Those that had the least amount of rest, it took 100 days. So you're looking at 2 months worth of difference. If you take it easy, you look at the symptomology, you don't push, and you treat and increase as appropriate. So really important that you get that cognitive rest up front. So there is research now that is coming out to support that. One of the handouts that I have that's available, you can have online as well as in the back, that you can look at, again, kind of talks about the symptoms, talks about health problems, the headaches, the balance, the sensory, what to do, and about brain steps is in the back, so that's available. And then just to talk about brain steps and how we can support students. We obviously, any students that has a lingering concussion, but also a student that's been in a car accident, that's had a tumor and has brain surgery, any situation like that we can certainly support. So it can be at any point in their life. Having difficulty at school and result of acquired brain injury. So concussion, again, typically after 4 weeks is when you can refer to us, unless, I think as Mr. Mills had mentioned, you're talking about someone who has ADHD or has an anxiety disorder. You can refer anyone who has that type or a learning disability. You can refer them earlier because, again, it is going to most likely be a lingering concussion. It's going to take them longer to recover. So the earlier you can get them into more targeted interventions and so forth, that's going to be a better thing. So definitely keep that in mind as far as concussion modifiers. All of brain injury severities, as I had just mentioned before, better sooner than later. So that kind of gives you an idea of some of the changes, well, some of the impact academically. Again, Brain Steps being a statewide program in Chester County, we have 15 consultants. We have referrals come in frequently. I would do an intake, talk with the family, talk with the school. We use something called the concussion framework, which we get information from the teacher, the parent, the student. We look at what their learning style is now, what they're able to do, what they're comfortable with, and we come up with some strategies and recommendations to support the student going forward in their academic day with their current symptomology. So I am available to families, I'm available to educational professionals, to self-advocates. And again, I'm at the Chester County Intermediate Unit. To make it more confusing, I'm Brenda Eaton at the Chester County Intermediate Unit. The state level person is Brenda Egan-Brown. So she is the state coordinator for the Brain Steps program, and that is her contact information. So I want to thank Mr. Mills for having me come out, and I want to say that I think Malvern Prep has a wonderful program, doing a wonderful job for the students. Brain Steps is a cutting-edge program in the nation as far as Pennsylvania having a program, and Malvern Prep having a concussion management team already and being at the level of support is really, really exciting. So thank you so much for having me.